pandemic has created a mental health crisis as more people need help with anxiety and depression. And now local mental health crisis centers and hospitals are dealing with a shortage of inpatient beds. This is specifically a problem for children and adolescents. So what can we do about it? Joining us now to explain, Dr. Kevin Caputo, the chair of psychiatry at Crozer Health. Good morning. Thanks for starting your morning with us.
Good morning, Bill. Happy spring.
Thank you very much, and try to enjoy it. Help me understand, so why is there such a shortage of inpatient beds? And this happened with COVID, pre-COVID? How do we get here?
Well, it's happened pre-COVID, but it's gotten worse since COVID. It's more difficult to place both adults and children and adolescents because of COVID. But we had a shortage of adolescent beds prior to COVID. It was always difficult to place adolescents, but now it's probably 10 times more difficult.
So it's not necessarily because of COVID or the actual illness. It's because of what? The screening process? It takes longer?
Yes. What happens is every patient that comes into a general hospital is screened. And if the patient screens positive for COVID, despite the fact that they may not have symptoms, they still have to quarantine. And you cannot quarantine on an inpatient psychiatric unit.
Okay.
So that makes it very, very difficult. So if the patient needs psychiatric hospitalization, we have them in a general hospital until their quarantine period is over.
Now, you said it was specifically, or I guess especially for children and adolescents. Is this a problem for adults as well?
It is, but historically there have been less child and adolescent beds, so the problem is worse with COVID.
So acknowledging the problem, then, what do you say to a family that has a loved one who has this need, but there's just not the space?
So we acknowledge the fact that we are limited by COVID, and we will guarantee to keep the child or adolescent safe during that interim period. We will watch them 24 hours a day around the clock. We will provide talk therapy, psychotherapy. We'll provide medications, but it's not a psychiatric hospitalization. We will reassure the parents that we're going to send that child or adolescent to the appropriate setting when it becomes available. And then our social workers work their tails off for placement. They call hospital after hospital numerous times, a day sometimes, seeing if a bed will open up. But we will never send anybody home in an unsafe situation, to an unsafe situation.
Yeah, we also just had a graphic up on the screen. So telemedicine, another option, I guess, for families as they're kind of waiting.
Yes, absolutely. But unfortunately, these kids are the sickest of the sick. They're the ones that really need to be in a hospital. They need to be watched. They need to be getting group therapies and individual therapies and daily therapies. Telemedicine is for the less ill patient.
So we talk a lot, and we're kind of seeing this trend towards things at least stabilizing, hopefully decreasing as it relates to COVID infections. Is that going to make things improve in this particular area as well? Do you expect that to happen soon?
Yes, I do expect it to happen soon, and it will certainly improve because as we have less children, adolescents, or adults that are COVID positive, there will be less of a placement issue. We will remain, however, with the shortage of adolescent beds in the area. That's not going to change.
Okay, and are there any additional resources that we should be paying attention to besides just inpatient for people who think they may be struggling or for families who need help?
Absolutely. That's a great question. What we want to do is we want to take care of the mental health issue before it reaches the point of hospitalization. So there are still a lot of outpatient clinics and outpatient practices that are operating either in person now or via telemedicine. If we can take care of the problem earlier, sometimes that obviates the need for psychiatric hospitalization.
I appreciate you starting your morning with us. It's good for people to know that there is help there even when they feel discouraged. So thank you for sharing that this morning.
Sure, there's always hope, and I appreciate being here today. Thank you.
Absolutely. Thank you very much, and you have a good one.